Dear audience, welcome to my 6-month progress report where I present my projects that help strengthen the relationship of acute pancreatitis with cancer. My name is Jimin Lee and I'm currently a 6th-year medical student at Semmelweis University. I'm also an MD PhD student enrolled with the Center for Translational Medicine, where my vision is to improve the prognosis of pancreatic cancer. To achieve this, my current mission is to prevent the progression of pancreatic cancer into its later stages by determining its early predictors. So currently I have 2 ongoing projects. In my first project, I am looking to strengthen the relationship between acute pancreatitis and pancreatic cancer, and this will be a systematic review and meta-analysis. In my second project, I want to determine the prevalence of pre-existing malignant tumors in acute pancreatitis patients, and this will be a registry analysis. So my first project will be to investigate the effect of acute pancreatitis to the development of pancreatic cancer. So despite the advances in medical technologies, pancreatic cancer continues to be a deadly force within the medical field, where it is predicted to be the second leading cause of cancer-related mortality by 2030. Pancreatic cancer is known for its asymptomatic nature, making it difficult to make an early diagnosis and often discovered in its later stages. Less than 20% of pancreatic cancer patients are eligible for resection at the time of diagnosis, resulting in a much poorer outcome. Therefore, there is a need to clarify various predictors of pancreatic cancer in order to detect pancreatic cancer in its earlier phases. Acute pancreatitis, which is the most common cause for the inpatient gastrointestinal hospitalization, can serve as a possible predictor for pancreatic cancer. It has been associated with pancreatic cancer, however, the exact relationship continues to remain unclear. So with this in mind, we would like to investigate the rate of pancreatic cancer diagnosis among acute pancreatitis patients. So to investigate this issue, I formulated the following question. Does acute pancreatitis increase the risk of pancreatic cancer? Here we want to determine the incidence of pancreatic cancer in the adult population with acute pancreatitis. And we believe that acute pancreatitis will increase the risk of the development of pancreatic cancer. And if our hypothesis turns out to be true, then we can establish an adequate follow-up strategy within this acute pancreatitis population in order to detect pancreatic cancer at an earlier stage where the outcome is more favorable for treatment. If there's enough data, we would also like to conduct a sub-analysis answering the following question. What are the risk factors for pancreatic cancer in patients with acute pancreatitis? We constructed the PFO framework where we want to assess if certain factors will have an effect on the acute pancreatitis patients on the risk of developing pancreatic cancer. And we believe that certain risk factors after acute pancreatitis will augment the development of pancreatic cancer. And by identifying these risk factors, we can also characterize the subpopulation, which helps the clinicians develop an adequate follow-up strategy in these subpopulation in order to detect pancreatic cancer at a much earlier stage. So we conducted a systematic search on 3 different online databases on October 11, 2023. We used a search key with 2 different domains, where the first domain described the acute pancreatitis and the second domain contained different terms that described the pancreatic cancer. And from our search, we had a total of 32,313 articles, which we narrowed down to 24,875 articles after the duplicate removal. And after the title and abstract selection and the full text selection, we had the final result of 58 full text articles, which were eligible for our study. And this is the current progress of my first project, and we are currently in the progress of extracting the data from the 58 full text articles and preparing them for analysis. So unfortunately for this progress report, I do not have any figures to present. So moving on to the second project, I would like to investigate the prevalence of pre-existing malignant tumors in patients with acute pancreatitis. After discharge, the first-year mortality in acute pancreatitis patients was almost double compared to the in-hospital mortality, with age, comorbidities, and acute pancreatitis severity being the most significant risk factors for death. It was also found that acute pancreatitis-related mortality rate was 9 times higher in patients who were older than 60 years of age, which brings us to the question, is this increased mortality rate due to aging itself, or is it due to other comorbidities that comes with age? And one of the possible comorbidities that was found within the studies was cancer-related cachexia, which was one of the key causes of death in the later phases after acute pancreatitis. So with this in mind, it brings us to the aim of our study, to investigate the prevalence of malignant tumors in acute pancreatitis patients. So with this being a registry analysis, we'll be able to evaluate several variables. So we came up with 2 different clinical questions. In the first clinical questions, we want to discuss the following. Is acute pancreatitis associated with a high prevalence of malignant tumors? Here we constructed the COCOPOC framework where we want to assess the prevalence of pre-existing malignant tumors in the adult population with acute pancreatitis. And we believe that acute pancreatitis is associated with a high prevalence of malignant tumors. And if our hypothesis turns out to be true, if an acute pancreatitis patient comes to a clinic or hospital, then the clinician or the practitioner can be more aware that this patient may have an underlying pre-existing malignancy. For our second clinical question, we divide into two parts. In the first part, we want to discuss the following. What is the prognosis of patients with acute pancreatitis associated with malignant tumors? Here we want to analyze patients with acute pancreatitis and compare those who have pre-existing malignant tumors and to those free of cancer. And we want to assess the prognosis in each group. Some prognostic factors that we can evaluate or analyze are hospital mortality, length of hospital stay, and even ICU admission. And we believe that pre-existing malignant tumors are the risk factors for severity and mortality in patients with acute pancreatitis. And if our hypothesis turns out to be true, then we can do a close monitoring of this subpopulation of acute pancreatitis patients so that we can promptly identify the associated complications that may come with the malignancies. For the second clinical question, we want to ask the following. What are the risk factors in acute pancreatitis patients for having pre-existing malignant tumors? Here we constructed another PFO framework where we want to assess factors such as demographics, comorbidities, epidemiology, and among others that we might find in the registry, and see their effect on the patients with acute pancreatitis, and assess the risk of those patients of having a pre-existing malignant tumors. And we believe that the subpopulation of acute pancreatitis patients are at a higher risk for having a pre-existing malignant tumors. So if we can identify these risk factors, then we can also characterize the subpopulation and allowing us to identify which population is at a higher risk for cancers and allowing for us to develop an adequate follow strategy in order to detect it at an earlier stage. Just one thing to summarize. Our main focus for this registry analysis will be to focus on the determining the prevalence of the pre-existing malignant tumors in the acute pancreatitis patients. And for the second clinical question, on one hand, we want to determine the prognosis of these patients, and on the other hand, we want to characterize the subpopulation who is at a higher risk for the malignancies. So the registry that we'll analyze will be an AP registry that was formed by the Hungarian Pancreatic Study Group, which was formed in 2012. And it currently has 27 uploading centers in Hungary with a total of 4,884 cases. However, this number of cases may change depending on the data available and also my eligibility criteria. So the data was collected from two forms. Form A being the data collected upon admission, and Form B, which was the data that was collected during the follow-up evaluation. The blood samples and patient data were prospectively and reliably collected, making this a high-quality data sample for our study. So to summarize, I want to strengthen the relationship of acute pancreatitis with cancer in order to improve the prognosis of them through the early detection of the cancers. And for my first study, I want to have it ready and submitted by June 2024, and my second study, December 2024. And to end, I would like to quote Marie Curie, where she said, "Nothing in life is to be feared. It is only to be understood. Now is the time to understand more so that we may fear less. Cancer is a terrifying disease because its nature is poorly understood. With my studies, I hope that we can better understand the nature of cancer through its association with acute pancreatitis so that we may fear it less." Thank you for your attention.
Until the others are thinking, I was just wondering that I know that you are in a very preliminary phase of your study. However, did you recognize any surprising prognostic factors or risk factors for the pancreatic cancer in the AP?
Unfortunately, like you said, it's a very preliminary part, so I wasn't able to look deeply into the data, and unfortunately, I cannot give you a confident answer.
Okay, thank you. And regarding your second project, for your first question, do you plan to match these patients for age and sex and other comorbidities? Do you have enough data to do that actually?
Unfortunately, I don't know how this registry is like and what kind of patients we have within the registry, so again, unfortunately, I cannot give you a clear answer on that.
Okay, thank you, and keep it up, the good work.
Thank you.
for your first study, is it? Do you have a time frame to investigate the development of cancer in acute pancreatitis patients? Or is it a lifetime risk?
So the time frame from the studies that I've looked at that was included, there was not an exact time frame that was indicated from the studies. Some may say 5 years, 10 years, or some studies even indicate that the highest increased risk was within 2 years after acute pancreatitis. So there's not a uniform consensus of how many years that we should do it. So with my study, I hope we can determine a clear point of how long we should follow up these patients.
Okay, and regarding your second study, do you have any data for subgroup analysis for different type of cancers and different stages?
And unfortunately, I do not have any data concerning that.
Based on these preliminary data that you have, what would be your suggestion for a psychologist who are dealing with these people? How could you translate these results? And I mean, what are your fantasies? I know that these are preliminary data, but still, what are your thoughts about that?
So you want to ask how I would deal with these patients?
Or how could a psychologist help you who is informed by these results that now you have?
Of course, like I mentioned, cancer is a terrifying disease and it's going to take a toll on the patient's mentality. So I think just to kind of ease the patient into that there's still a possibility that, well, if my hypothesis turns out to be true, then there's a possibility that you may develop pancreatic cancer, but with adequate follow-up strategies and adequate detection methods, then it's still a treatable disease.